Imagine you've been parking in your parking spot and you never knew that you needed to pay for parking. How much would those fines accumulate to after 5 years, after 10 years? Compare Medicare penalties to a parking ticket. That is not, you pay monthly and you pay for the rest of your life. Ignorance is no excuse. The government won't warn you, but they will fine you. If we haven't met yet, my name is Sebastian Correa. I'm a local health insurance broker here in Ocala in the Villages, Florida. Today we're going to talk about penalties, how to avoid them so you don't have to pay a single dime to the government. So let's divide all these penalties. The first penalty I call the big one, and this is the Part B penalty. So let's talk about why I noticed that so many of my clients are having so many issues with penalties. You don't get a welcome letter. People tell you to sign up for Medicare. They tell you that you need to sign up, and nobody tells you that there's a penalty. You find out much later. So when you're first eligible for Medicare, think of it as a sandwich. You've got 3 months before your birthday. Those 3 months are eligible. You've got the month of your birthday, and then you also got the other 3 months right after your birthday. If you fail to enroll in this window, there is a 10% penalty for every year for the rest of your life. So the next penalty is actually a Part D penalty. And this one I could refer to it as the sneaky one. So if you haven't seen my last video, I had a client, Lihia, who for 10 years did not pay a Part D because she never needed a prescription. She thought she was being smart. She thought she was saving money. So because she never signed up for a Part D when she was first eligible, 10 years later, there's a 60% increase in lifetime penalties every single month because of those 10 years that she did not enroll. The other confusing part is that some folks I spoke to, they think that Medicare Part D plan is a supplement to what Medicare already covers. So they also think the idea, hey, they are healthy, they probably already have the prescriptions covered. They fail to realize that Medicare A and B does not cover prescriptions unless they're not self-administered. Medicare Part D is separate, and if you don't get it when you're first eligible, you will be fined. The solution, if you're healthy, you don't need any prescriptions, at least in Florida, there's options where this prescription drug plan is $0. Now let's talk about a rare scenario, and that is the Part A penalty. So remember, Part A is kind of like that analogy of the 4 walls of a hospital or a facility. Part A is free. There's no reason why anybody should be paying for Part A unless they did not work 10 years or 40 quarters. The trap is if you did not work 10 years or 40 quarters, you do need to get a Part A right away. Now the question becomes, if you're working and you're still employed, do you have to enroll in Medicare? So don't worry, you don't. If you're working and your employer is at least 20 employees or more, you could stay working and continue to keep your coverage. And the reason it's 20 employees is because that's what's considered for Medicare credible coverage. So basically, if you could decide to continue working and not retire at 65, you have the option. You can choose to be on Medicare and not go through your employer's insurance any longer, or you can choose to continue your employer's insurance, and when you are gonna retire or you lose coverage from your employer, you now can enroll in Medicare without a penalty. So another Part D trap that some people have if they stay working is that they don't realize that maybe they have credible medical coverage, but their prescription coverage might not be credible. So if they don't have prescription coverage that's credible, they will get a penalty even if they're working and have health insurance. So you need to check with your HR department and make sure that it's credible. If you have more than 20 employees where you work, you don't need to worry so much about your medical penalty with Part B or Part A if you decide to go on Medicare later. But double check with HR that you do have credible coverage for Part D or prescription drugs. And if you do, you have the option to do either. Join Medicare and leave your employer coverage, or stay with your employer coverage and delay enrolling into Medicare. You cannot do both. So now you're no longer driving blind. and you don't have to worry about this parking ticket. You know the trap is there. If this video has saved you from a potential penalty, click like and share this video with as many folks that you know. The last thing you want is for them not to know that they're gonna have penalties if they don't enroll when they're first eligible. Also, if you're still confused whether you should get on Medicare or stay with your employer plan and you have that option, on the comments below, just let me know the scenario and see if I can help. Now you know you have to sign up. The question is, how much is this all gonna cost? The next video, I will share the cost for 2026 that you can expect for if you're enrolling into Medicare.